Well, a first-of-its-kind study in the country done right here in Minneapolis could be the key to saving lives.
The study focuses on certain types of stroke prevention. Fox 9's Scott Wasserman joins us now. And Scott, you spoke with the doctor who came up with this idea.
And he's very passionate about this. Every year, 30,000 people across the country suffer from a ruptured aneurysm. Thankfully, 60% survive, but many are at risk of additional fatal or debilitating strokes. Strokes one doctor is trying to prevent before they happen.
This shows the aneurysm here.
Dr. Yasha Kadkodayan is on a mission to save lives.
When the arteries narrow to this degree, the patient is at high risk for strokes.
The neuroradiologist at Abbott Northwestern Hospital is researching how to stop repeat strokes for patients who suffer ruptured aneurysms.
Vasospasm can occur along any of the vessels that are going to the brain.
And that's your worry.
That's right.
Vasospasms, which creates lack of blood flow to the brain, occurs in 30 to 40% of patients who suffer ruptured aneurysms. The results, often a devastating stroke.
If we can just help just a few patients every year to overcome those odds, then that makes all the difference.
But right now, the only prevention is neurological monitoring and ultrasounds.
They are good tools at suggesting the presence of vasospasm. However, they're not good at detecting whether or not the vasospasm is significant enough to cause a stroke.
A stroke that happened to then 22-year-old Annie Stroh.
This never happens when you're young. So obviously it wasn't even on my radar.
Annie suffered 2 more strokes after her initial aneurysm.
I couldn't remember things like right away after it happened.
5 years later, she has recovered and now has a family.
I feel so blessed every day.
We're extremely lucky that she's alive.
To prevent these repeat strokes, Dr. Kadkodayan is using new MRI technology in a first-of-its-kind study in the U.S. He says the MRI can map out the brain and monitor blood flow.
This new method will help us detect vasospasm and determine whether the vasospasm that we see is significant enough to cause a stroke.
I really hope that they have better technology other than just the ultrasounds to track them well before they happen and even prevent them from happening at all.
I feel like if we can prevent just a few of those cases a year, we've accomplished a great deal with this study.
Now, the 2-year study, which is just beginning, is expected to include 50 patients. They'll undergo 4 MRIs, the first when they arrive at the hospital, one at 7 days and another at 30 days, and then another if the symptoms start presenting. The study is funded by the Abbott Northwestern Hospital Foundation. Leah, back to you.
For those of us with strokes in our family, that's some good information. Thank you, Scott.